Today we have with us Dr. Mitesh Sinha, who is the associate professor and also consultant neurophysicist from Department of Physiology, currently working in Government Medical College, Raigarh, Chhattisgarh. Dr. Mitesh, welcome to National Dynamic Medical Student Summit. It's a pleasure to have you today.
Thank you, Dr. Sajjan.
Right. Dr. Mitesh, this is entire summit about specialties after MBBS for the medical students, to them to understand what career pathway can choose and what are the opportunities in that career pathway. So in this particular discussion, we'll be looking more into physiology and how it has been evolved. And you are also working as a consultant neurophysicist, no physiologist, right? Something which is new, which I, by being in medical field for so long, are not much aware of, and of course students would get given new opportunities for them to understand in this particular area which you're already practicing, right? So that's a great, so let's continue the discussion and know more about you and what passions and how you have been in your career, and so that the students can get an insight into that.
Yeah.
Right. Dr. Mitesh, first let's understand, why do you choose physiology as a specialty for yourself in career
Oh,
path?
actually, yeah. Normally, physiology, it is not the first choice of most of the aspirants.
Mhm.
But if you have interest in academic and research, in starting, I was not having much insight about what is physiology, but I was having some interest in academic and research initially. So, and I was not able to secure a clinical seat. So among the pre and paraclinical, I decided to go with the physiology for pursuing my post graduation.
Right. So being in physiology now, be your associate professor, also being consultant. No, it's been a long time since then. So, what do you think the advantages of being in the specialty as in MD physiology?
Yeah. See, one of the advantage which I find is there's a good balance of work and life, which is a rarity in our medical field.
Hmm.
And if you, as I have started doing neurophysiology work, if you properly explore the different aspect of the branch, then there is good job satisfaction also.
Right.
And uh, in every pre and paraclinical branches, as you know, nowadays you are safe from the ethical issues and violence against the doctors. And
Yeah.
finally, yeah, and now currently in India, most of the physiologists, they are not exploring the various other aspects. So
Hmm.
to settle yourself or to get yourself in the groove, it is not very difficult. So it is a little advantageous. Yeah, if you go only with the academics, then it will be a little difficult. But if you explore the other aspect, as not many people are venturing into it, you can easily get it.
Great, great. So that's really nice to know, something which is new from the physiology point of view, right? Dr. Mitesh, you told about the advantages. What could be the disadvantage of being in this particular specialty?
Uh, See, disadvantage of being in a pre or paraclinical branch is that you don't have that much of patient interaction.
Right.
That is some whenever we become a doctor, we have a feeling in the initial stage, years, first or second year, that we have to treat patients. But during the course, many people they don't want to do patient interaction much because of
Mhm.
the changing scenario nowadays.
Right.
So that could be a disadvantage, that you have less patient experience. And if you choose only academics part, just as many of the physiologists are right now doing, then it will become very monotonous.
Yeah.
So if you choose to do physiology, you have to explore the other aspects also.
Hmm. Got it. So, in your view, for whom this particular career choice would be an ideal thing to choose?
For students who want to do a post graduation in pre and paraclinical branches, and who have a good want to have a good work life experience, and their inability to get a good higher rank in pre PG, and they
Mhm.
have to choose among the pre and paraclinical. then physiology can be a good choice in that condition.
Got it. Got it. Great. So once you take physiology as specialty, then, so what are the super specialization opportunities or any further growth of career? How can they do? What are the opportunities there?
Yeah, right now there are some not in the form of DM, but there are some
Hmm.
fellowships and the
Right.
PhD, which will be done in physiology, which have a very good prospects.
Hmm.
One of the few physiology fellowship is in neurophysiology,
Hmm.
that is being given in Mumbai,
Hmm.
and NIMHANS is also providing this training for physiologists or
Right.
neurophysiologist fellowship
Hmm.
and PhD also. After doing PhD, AIMS, JIPMER, uh, from premier institutes, if you do PhD, you have good
Hmm.
chances of going to abroad. So there are, then also there is a course called FEMER.
Hmm.
FEMER, that is fellowship about medical education.
Hmm.
Right now, many of the physiologists, some are doing research in medical education also. It is also a very good branch for research, and I would like to say one of our very senior pediatrician from CMC Ludhiana, he is Dr. Tejinder Singh. So he has
Hmm.
received Dr. BC Roy Award
Oh,
for medical
okay.
education.
Hmm.
He is running FEMER classes in CMC Ludhiana, and he has received Dr. BC Roy Award.
Hmm.
So these are the various fellowship and super specialization which can be done after doing physiology.
Right. So now, once everything in place, so what are the career opportunities once they complete the MD physiology?
First of all, after doing MD in physiology, you can join medical college. You
Yeah.
can join medical college as a faculty, and
Hmm.
along with that, you have ample time to do other things.
Hmm.
So as I am doing, you can learn various interpretation of various investigations such as
Hmm.
EEG,
Hmm.
EEG, all of them know, EMG and NCV, that is electromyography and nerve conduction velocity. That is a
Hmm.
test for muscles and nerves. Then we have BERA, that is for auditory nerve, and VP, treadmill spirometry, and autonomic nervous system testing, allergens testing. So all these interpretations of all these tests, these skills can be endorsed during PG. And apart
Hmm.
from doing academics and research, you can also have a lab of this and engage in interpretations. And apart from that, you can collaborate with in metro cities. It is right now very popular in orthopedics, spine, or neurosurgery. You can
Hmm.
collaborate with them during for neuromonitoring.
Hmm.
They require neuromonitoring for various surgeries of scoliosis and spine surgeries. They require neuromonitoring.
Hmm.
So many physiologists are doing that in metro cities right now. And then you always have an option of starting your coaching institute, YouTube channels, or teaching academics, writing some books. Apart from that, right now we have some more, because even in after this corona, many people have become health conscious. So
Hmm.
a number of physiologists I know, they are opening yoga clinic.
Right.
They're doing a
Hmm.
research yoga clinic. Then there is a
Hmm.
biofeedback clinic.
Hmm.
Biofeedback clinic, it is also used to relieve stress, and many of I have two three seniors who are running biofeedback clinic, and then hypnotherapy clinic, allergy clinics. In these clinics, they can have an they can also be associated with along with the teaching in the medical college.
Wonderful, wonderful. You have opened a lot of doors for the students. Okay, because being in the medical college, the perception is only being a faculty, right? So students would
Yes.
have not seen anything else. So by whatever you shared, I think a lot of things have opened up. There will be a lot of opportunities what now students can look into physiology and choice of their in a career what they want. Okay, and any opportunities in abroad you could suggest of
Yeah,
after
there are
MD?
many openings after doing PhD
Hmm.
from some institute. There are many opening for research and academics in abroad. After PhD, Indian faculties are very sort of as
Hmm.
faculties.
Got it. Got it. So the opportunities are more after PhD to go and teach and train students in abroad universities, right? Got it.
Yeah.
Great. So now, coming to the point where the earning potential. So, what would the earning potential of an MD physiologist uh, looking into different career pathways which you showed me? What would be the range?
Yeah. In teaching profession, just I am talking about medical college.
Hmm.
In 8 to 9 years,
Hmm.
nowadays you become a professor of a medical college.
Right.
So an average professor, he earns around 2 to 2.5 lakhs per month,
Hmm.
and for an assistant professor, after completing PG, when you join as an assistant professor, you earn around 1 lakh per annum. So from 1
Hmm.
lakh per annum, you can reach to about 2 to 2.5 lakh per annum, no, per month,
Hmm.
by 7 to 8 years. And apart from that, if you open your clinic, neurophysiology clinic, or you are associated with neuromonitoring with some surgeons, or you have written some books and you are getting royalties. So then you can earn as much as you work. But
Hmm.
apart from that, I can say that in spite of all this, you will always get time to reach home by 5 p.m. You
Got
will
it.
have your time for you, your family. I am doing my academics also. I am involved in neurophysiology also. I am running a lab in private as well as running a lab in the college. And still, after 5, I get time for myself and my
Great. So now you already mentioned that, but still, as a question, what would be the work-life balance? How do you see it? It's great. I already mentioned, but any views on that?
Yeah. As far as I am concerned, I am satisfied. I am having good life balance, and I have opportunity to all my family meetings and
Yeah.
attend. Yeah, and if you have in medical college, many of our passions, we all have some passions, but when you come in the rigorous of post graduation and the rat race, then many of your passions are lost. So you always have time to follow these passions. You have time for yourself.
Right.
So basically, this can be an advantage if some people who don't want that hectic life schedule and still want some satisfaction, then they can choose for this branch.
Got it. Great. So now, looking into next 5 to 10 years, how would be the scope of MD physiology in your view?
See, currently, many metro cities, only metro cities are having these facilities. I would say that in Chhattisgarh, even big cities are not having these facility. I have started that in a small city, Raigarh, and still I
Mhm.
am getting a number of patients.
Mhm.
So slowly, as number of colleges are increasing, number of consultant who will ask for these tests will increase. The opportunity is going to increase
Yeah.
for all those who go and explore these aspects.
Right.
If anyone is just restricted to academics, then in coming years, physiology is should not be a sort of branch that people should think of physiology, because then it will become monotonous, and maybe getting into a medical college may also become difficult. So if you are ready to explore the other aspects,
Mhm.
neurophysiology, or opening an allergy clinic, or opening an hypnotherapy or biofeedback clinic, then it is a very good branch. Even in smaller cities, it will have a good response in coming years.
Got it. Great. So, Dr. Mitesh, so we just discussed a lot of academic things and the process of career pathway. So, right now, we'd like to know more about you and your personal journey. So, where did you do your MBBS and PG, and how was the journey? What are the challenges? Basic things. Could you just share about your career pathway from the UG days and PG, and now starting, getting into your neurophysicist, physiologist, and how is it happening now?
Okay. I have done my undergraduation from Ahmedabad,
Mhm.
and uh,
Which college?
I am from NHL Municipal Medical College. I have
Mhm.
done my MBBS from there, and after doing my MBBS, due to some problems, I was unable to get a drop. And the first in the first attempt of
Mhm.
post graduation and NEET exam, I got post graduation in physiology.
Hmm.
And at that time I was not aware of so much opportunities. So some of my I was very reluctant whether to take this branch, but I have to do something as there was no opportunity. I can't drop at that situation. So some of my faculties, some of my seniors, they told me that it doesn't matter which branch you choose from. The thing which matter is that you have to be best in your branch. If you are going to work hard and be best in your branch, then you will be benefited, whether you are taking anatomy, physiology, or radiology. And if you take a high end branch and even then you are not doing your best, then it will not be that beneficial. So I kept that in mind and started exploring this. And I did my PG from BJ Medical College, Ahmedabad only.
Hmm.
And sir were very supportive there. My PG teacher, he was also wanting that students should explore the new opportunities. But that time we tried a lot, but we could not start a lab at that time. Right now the college, BJ Medical College, it is having a good
Setup.
electrophysiology labs. At that time
Hmm.
it was not able to start. We tried a lot. After completing my post graduation, I went to Delhi. There is Dr. Hansraj sir. He
Hmm.
is a physiologist, and since 1983, he has been doing EMG and NCD in private in Green Park, New Delhi. So he is also a consultant neurophysiologist in Apollo Hospital in Indraprasth, Delhi. So he is not a he is doing private practice only. So I just mailed him, sir. I want to do an observership. I want to see how you work. There is no
Okay.
one to teach
Hmm.
because not many people are doing this, as you know. So I want to learn. I just want to do an observership. So I was having my summer vacations. That is also a perk of having a academic career, that you have summer vacations of 1 month. So during my summer vacation, I went to Delhi. He was very happy that some physiologists, they are trying to do this. So daily I used to go to his clinic and used to observe what he is doing. In the meanwhile, he taught me some things. And after coming from there, I started doing that in my lab in college. And it was initially very difficult because there was no one to teach. So I started learning from my experiences. The patient have to wait for 2 to 3 hours at that time for getting tested, because unless and until I give a diagnosis, I also have to read simultaneously. Patient was lying there, he had to read simultaneously, learn from that. And initially, after 6 to 7 months, I got a hold for it. And right now, I have a own clinic, own running own lab in private hospital apart from the medical college. And
Hmm.
two other private hospitals, they call me as a part-time consultant. So I
Hmm.
am associated with 3 hospitals right now, and also doing the clinical physiology lab in our college also.
Wow. Wow. So, Dr. Mitesh, that's been a wonderful journey, and I could see you have self-generated a lot of the areas in your lives to learn more and understand, and that's been a wonderful journey. And it's very inspiring to know the way you have, taken the career pathway of MD Physiology and did something more out of it as a neurophysiologist now. Great, wonderful, very inspiring to know the journey. Right. So, with that, no, so what challenges have you faced in your career process? One or two challenges which you can just tell us.
Initially, there are not many number of courses, not number of institute which are teaching these techniques.
Mhm.
That was the biggest challenge. When you are having as of now, that I have also thought of starting a 3 day or 4 day training program for EMG NCV, which
Mhm.
was held due to Corona.
Mhm.
We will start again this year if the conditions permit.
Wonderful.
So we can teach the students who are the budding physiologists that what are the new, how they can set up a lab, how they can do the work, how. So initially 6 7 months, I had to do it myself and learn on the patient myself,
Mhm.
because there was no one to teach. The biggest challenge was that. Secondly, when a neurologist or an orthopedic surgeon is sending a patient to you, then he is not expecting anything less than a diagnosis. He is expecting more from you, because as a physiologist you will have a lot to earn his respect,
Hmm.
because obviously he will see what he is always going to think that his clinical exposure, his patient, he is seeing the patient's clinical exposure, it is much more. So to make him believe that your report is right, you have to be more accurate, you have to be more precise, you have to have good knowledge, so that you can match his clinical diagnosis with your electrophysiological findings. So that was a challenge initially, and right now also, even you have to maintain your knowledge level, so that you give a correct diagnosis.
So, with all the challenges which you have faced and overcome, what has been the best part of being in this specialty?
um, I think the best part is I have tried to explore some other portions which were really unmanned right now. So it was a challenge. It was a challenge. So daily it is a daily challenge. So overcoming that, we are always excited to do some new work, and even you are getting appreciation from many seniors, colleagues, peers that you are doing a good work right now. So it is a good feeling that you are doing something out of the proportion, and trying to achieve something. That is a good feeling. I have a satisfaction, a good. I think the best thing is that I'm having a satisfaction of doing my work. Also doing some research in medical education also. So it is a good feeling to have doing something which really matters.
So, yes, great. So finally, we are almost at the final part of the session. So, what would be your guidance for the young doctors who are inclined to take MD physiology as their career path?
Uh, I would say that if you are selecting MD Physiology as a branch, then you should be sure that you are not only going to do academics. You are not just for joining the medical college and being an assistant associate professor. That should not be an aim. Otherwise, in coming years, 2 3 years, it will become very monotonous, and it will be very hard that you are not doing anything. You should explore. You should learn some skills in the post graduation. After post graduation, pursue in that branch. Either it can be a biofeedback clinic, a neurophysiology clinic, or hypnotherapy clinic, and then it will be fruitful. And if only you are choosing academics, then because many people are doing already working in medical colleges, so it will be difficult to be uh, set up in the current scenario.
Right. So, Dr. Mitesh Sinha, it's been wonderful interacting. It's very inspiring to know you and your journey, the way you have taken the MD physiology to the next level with practically practicing and implementing, and also planning to also guide the new upcoming physiologists who can take up the skills which you already know mastered currently. So great. Thank you so much, Dr. Mitesh, being here with us, sharing your knowledge, experience, and no, it's also wonderful to get connected with you, and no, your guidance would actually help a lot of medical students to take physiology as their career path. Thank you, doctor.
Thank you.
Isn't this valuable to know the career pathway of a specialist? Hear from experiences of 50 plus consultant doctors from across India. Get an insight into 22 plus medical specialties and make an informed career decision which will shape your future. Join India's first of a kind online medical specialty summit exclusively designed for medical students. Visit our website drsajjanacademy.com to know more. Don't miss out on this golden opportunity.